Looking after your surgical wound at home. What to expect from a surgical wound and how you can improve healing at home after the dressing has been removed. This information is a collaboration between clinicians, academics, and patients. After surgery, the surgeon closes the skin to allow the wound to heal.
A woman with a wound.
Your body is healing itself underneath the skin. This healing process continues for weeks and even months after the surgery.
The woman's wound is healing.
This video explains how to care for your wound at home. Most wound materials allow for light showering,
Image of a wound suture.
but avoid soaking or extremes of temperature. Surgical tapes do need to be kept dry for about a week,
Surgical tape.
then gently soaked and removed once they start to curl. By 2 weeks, any clips and removable stitches need to have been taken out by the nurse, and strong sutures after around 3 weeks.
Image of a surgical removable suture and extra strong stitches.
Soluble sutures dissolve over 2 to 4 weeks.
Images of soluble stitches and tissue glue.
If adhesive glue is used over the skin, this will come off naturally after about a week. Or your healthcare team will tell you if it needs to be peeled off gently. Most wounds heal well, but about 1 in 20 may get infected. Antibiotics target bacteria to treat infections.
An illustrated bottle of antibiotic next to a group of bacteria.
You should monitor the wound for infection signs, and you should seek prompt medical review for early detection and treatment. Signs of infection include worsening or new pain,
A woman in pain.
continuous or recurrent fluid, blood or pus from the wound,
A wound with fluid or blood.
bad smell,
Woman holding her nose for bad smell.
new noticeable heat,
Thermometer signifying high temperature on wound.
obvious changes in the surrounding skin color,
Image of skin turning purple.
gaping or opening,
Image of wound opening.
new swelling,
Image of a swollen wound.
or if you feel generally unwell or have an unexplained fever.
A woman feeling unwell.
With one or more of these signs, always follow the tailored advice from your healthcare team.
List of signs: worsening or new pain, continuous or recurrent blood or pus from the wound, bad smell, noticeable heat, unexplained fever, changes in the surrounding skin color, gaping or opening, new swelling.
There are general tips to prevent infection and help healing.
Regular assessment, wound protection, oxygenation, nutrient supply, recovery. For 2 to 4 weeks.
Keep hands away from the wound
Icons of hand avoiding bacteria.
to prevent bacteria and aid healing. Allow warm water and liquid soap
Icons of water and soap.
to roll over the wound to prevent bacterial buildup. Dry the wound separately with a clean towel to avoid transferring bacteria.
Icon of a wound and a towel.
Leave the wound uncovered to increase air circulation
Oxygen icon.
and discourage bacterial growth. For 6 weeks, avoid strain or pressure on the wound to prevent splitting.
Icons about avoiding sports.
Maintain a healthy lifestyle with a varied diet, good hydration, regular walks and rest to support healing.
Icons about good food, vitamins, water, walks and good sleep.
After 6 weeks, massage the area twice a day with a simple moisturizer to improve the strength and the appearance of the scar.
Icons about hands massaging wound and of moisturizer bottle.
Protect the wound from the sun for 2 years to prevent sunburn due to scar sensitivity.
A man with wound. Icon about avoiding sun. Icon of protective clothing and sunscreen protection.
Consider taking photos of your reference or hospital wound monitoring systems.
Hand with smartphone. Taking photos of the wound.
Proper wound care is crucial for successful recovery. Patients, caregivers, and healthcare teams can improve healthcare together.
Icon of a patient surrounded by icons representing hospital teams, carers, pharmacy colleagues, general practitioners, family and community teams. This video was co-developed with Buckinghamshire New University, BNU, and the Surveillance and Innovation Unit, Guy's and St Thomas's NHS Foundation Trust and Patients.